I am Alisha from adultspeechtherapy.co, and in today's video I'm going to show you a fluency technique called metronome. So metronome technique is used for patients who demonstrate stuttering as well as other motor speech disorders such as dysarthria, if they're having difficulties with rapid rate, or if they have apraxia of speech, and it can actually help with the motor planning for speech production. So those motor speech disorders can all be acquired, like adult onset, such as with a traumatic brain injury or a stroke. They can be present in progressive neurological conditions, or as in stuttering, they may have acquired it as a child. So with metronome, we are going to use a metronome, and I have a free app that I downloaded on my phone that I'm going to turn on. And so basically I am telling the patient that I want them to produce each single syllable at the beat of the metronome, and it's going to help them slow down their rate. And you want to start at a slow rate, and it will feel unnatural, but the goal is to eventually get back to a normal speaking rate, because again, these patients may be speaking too quickly and need to utilize a much slower rate at first. So again, I'm going to pull up my metronome, and I have it at a pretty slow rate of 55 beats per minute. So I'm going to start the metronome, and you can hear it. And so now I'm going to start some short phrases just with the beat. Good morning. How are you? I am good. What is new? You can also just use it with words such as single syllable, ball, Tom, shelf, door, or 2, 3, or multisyllabic words. Handle, apple, hippo, tomorrow. So it is a little tricky at first, and you may have to demonstrate it for your patients. But again, it's a great strategy to use and helps your patients really slow down their rate of speech and help their overall speech intelligibility and fluency. Good luck teaching your patients how to use the metronome technique. For everything else, including free PDFs, check out adultspeechtherapy.co.